Hello and welcome. In this short video we will have a look at local anaesthetic paste and run through how we would use this and prepare it for use in dental analgesia cases. So this is how local analgesia paste comes. It comes in this is just one particular brand. It comes in sort of like a toothpaste tube in a sense. And this is xylocaine by AstraZeneca, I think, from memory. And it comes as a tube, and it's a multi-use tube. So that means that we actually have to be a little bit careful with how we use this material. We don't want to use it on patients and have their bacteria and their mouth environment end up on the tube. So we have to be careful with this tube and treat it to keep it away from patients, but still be able to use the material in it. Now, just to show you what the material actually looks like, when you unscrew the top, just like a toothpaste container, and you squeeze the tube, as you've seen, this tube's been well used over the period. You can see here it comes out. It's just a paste that you can see coming out of the tube. Now, you don't actually use your finger to grab this material. What we usually use is sort of a cotton bud, like this. So we get a brand new cotton bud every time you touch the tube. That's the key thing to remember. It's very simple actually. Every time you go to this tube, you use a brand new cotton bud. Never use a recycled one or one that's been used on a patient already. So all you do is you grab some of the paste on the cotton bud. Now, what the amount you're seeing there, it will vary between clinicians as the amount that they like to use, but in my case that's about the amount. Probably that's a bit frugal. I'm a bit frugal with it. Probably use 50% more than that. Let's get an amount on there, shall we? Probably about that amount, let's say. Would be good. Let's get that white out of the way so you can see it. There it is there. And that's how you collect the paste, and this paste will then be transferred to be used on the mucosa prior to giving local anaesthetic. There's a few key things about the use of this paste. It does take time to work. So when you put it on a patient, you actually have to put it on early and give yourself a period of time for it to work. It's not a miracle paste. It actually has to have time for the drug to diffuse through the epithelial surface to then affect the underlying nerve endings. And the other key thing when you're using local anaesthetic paste is to actually dry the surface thoroughly before you put it on. So the idea would be to use a piece of cotton roll or something to make the surface very dry. Then you put this paste on and you leave it on. In fact, I've seen some clinicians who have this very clever technique where they will put this paste on before they actually start talking with the patient. So they'll pop it on there and then have a conversation with the patient to get them at ease, and that will give them a period of time for the paste to work. So this as an active ingredient, and you can see on the tubing here, if you read the fine print, I'll just pop this down over here, get that out of the way. If we get this steady, you'll be able to read the fine print there. This actually contains lignocaine, so it is the same local anaesthetic active ingredient that you find in the solution for most commonly used local anaesthetics. So this is the paste that we use. The only other little thing in with this is to make sure it's used only on complete surfaces. We don't try to use it. We don't use it on open bloody fields or anything. It's not really effective in that case. And do make sure you keep it with its lid on when you put it back in the cupboard.